My name's Dr. Helen Leonard. I'm a specialist in Paediatric Neurodisability and I'm a consultant here at Great North Children's Hospital. I've been here for 3 years and I've been a consultant for about 10 years now, working in different places within this specialty. So in my current post, I do the assessments for most of the preschool children for Newcastle. So that's something we see a lot of and we see in increasing amounts as well. And I would say most of the children come to us because they're not talking. That's a usual flag for preschool children, especially around the 2-year check. By then they should have developed some language, and the health visitors are looking out for that with the questionnaires they do and the questions they ask parents. And the most common reason I would say would be that children aren't talking. Now, of course, autism isn't the only cause of that. So GPs, health visitors have had some training in looking for the things to other things that might flag up that this could be autism. So children who have autism, not only are they usually not speaking preschool, they're not attempting to communicate in other ways. So normally toddlers that age are pestering their parents to be with them all the time. They're wanting to play. They're very good at making their needs known. And often children with autism are quite self-contained. They're not dragging their parents to things. They're not wanting them to play. And the phrase that families often use is they're in their own little world. And that's a common phrase. I find increasingly now parents will go to the internet, be concerned about the child, start to Google things, and then sometimes in years gone by parents would just come and say, oh, I'm concerned they're not speaking, I'm concerned about the play. Now often they'll come and say, we've actually looked this up and we wonder if they might have autism. And I think awareness has gone up as well. And the other thing is they often say, you know, a neighbour or a friend or somebody down the street or my cousin said, actually, I've been looking at your child and he just reminds me of somebody else, and have you thought about autism? And it's other people, because there's so much public awareness of it now, are actually sometimes raising the issue with families as well. So I think it's now less of a surprise to families when they're referred in, and often they've kind of realised themselves or somebody close to them has realised as well and pointed out that that's a possibility. So yes, I'm very passionate about that. Early diagnosis is really important. We see children now as young as 1, sometimes in the service, not that often, but we do. And it's often when they're younger brothers or sisters of an older child of autism. So people are really vigilant. They know that there's an increased risk for that child and they know the things to look out for. And certainly if it's severe, we can diagnose even under 2. We can spot children, although that's relatively few. Early diagnosis is important because there's increasing evidence about the benefit of early intervention. So if you can get in there soon with speech and language therapy, with educational therapy, with strategies to promote interaction and communication, even if that's not verbal, it's not through talking, then it really helps the child socially, and it helps to build those early communication skills that then year on year you build. There's evidence from international research trials about the benefit from early intervention, and there's currently a trial. Newcastle's one of the centres in the country for the PAC-G trial, which is running at the minute, which again is a trial building on this team's previous work looking at the benefit of early intervention. So I would say each year the research evidence gets stronger, but I would say as a professional working in the field for a long time, you can see the benefit yourself of families who received early intervention, both for communication but also in terms of behaviour difficulties later on. Well, I can only speak for the children I see, and we only see under school age children, but it's, I would say, a common point of referral is from the 2-year check. They would usually initially be assessed by a speech and language therapist, but sometimes if the health visitor is very good at spotting the difficulties, or they've been referred to speech and language therapy from the health visitor, they then come in sort of post 2-year check. And then another often common point of referral may be where a child has better language skills but has more of a behavioural difficulties associated with autism is when they enter nursery at 3. And again, nursery staff are really, really good at spotting typically developing children, what children should be doing, and spotting children as they come in that have those difficulties that we see in autism, and looking at them, watching them, see if they're progressing, and if they're not picking up the communication and social skills they should be, then flagging it to families to get a referral into our service. So I would say 2-year check and nursery entry are common points. We sometimes get referrals that say, I know this is probably too young, but they might have autism, and that's not true. Like I said to you earlier, if it's you know what you're looking for and the child has very obvious problems, we can diagnose even before they're 2. So I would say it's never too early to refer if you're suspicious. I would say it is more common in boys, and people often miss it in girls, I think, because girls compensate more, and probably for the complex reasons it's harder to spot, but it does affect girls as well, so don't dismiss it then. So I think there's 2 parts to that question, really. One is that sometimes children with autism have another medical condition. And I think the other thing with autism is that there's what we call comorbidities with the autism, which means that they have autism, but there are problems around sleep and eating that commonly affect them. So if we cover the first one, as part of an assessment for autism, certainly for the younger children that present, they usually see a paediatrician looking to see if they have any signs of another medical condition. So for example, autism is much more common in children who have genetic problems like Down syndrome, who have neurofibromatosis, in children with muscular dystrophy. So you've got to check that this is just autism and it isn't part of a much bigger medical condition, and that would be why a paediatrician is usually involved in diagnosing the younger age group of children. And there's a wide number of those conditions. I won't go into them all because you'll fall asleep, I'm sure. But so you need to rule out other conditions. And for the children I see now, we offer genetic testing to all of them, and we pick up problems in around about 10% of the children we see. And we offer testing for other things like checking for muscle problems, thyroid, and other things like that, as well as a very thorough physical examination and a look at the family history. So that's part of your question. The other thing that we see is a lot of the children we see who have an autism diagnosis without it being part of a bigger condition have what we are sometimes known as secondary behavioural difficulties. So because they are very much stuck in their own agenda, routines, have sensory issues as part of the autism, that will then affect the way they eat, the way they sleep, their behaviour if you take them out to a busy public place. So we also deal with those secondary issues that families have. So we need to offer support, for example, around children who are very, very restricted in the texture or smell or taste of what they'll eat. So their diet is nutritionally very poor because of the core symptoms of their autism. And we get involvement from dietitians and occupational therapists to help us deal with those problems. Yes, I think certainly in Newcastle we have, and our numbers have gone up enormously in terms of the children who are referred, which is good because people are recognising it. But that isn't isolated to Newcastle, that's something that's happened nationally, and in fact has happened internationally. And if you look at data of incidence of autism across the world, each time a study, a newer study is published, the incidence seems to be rising. Now, part of that we know is better recognition, which is good. And we know that some of the children who were previously diagnosed as slow learning disabled are now recognised as having autism. So that's part of the increase, but there may be a true increase in the background as well, and we are not sure of the reasons for that, and it's something that people are looking at with research. Families of children with autism are very reliant on public services in the UK. I can speak for UK children. So from education, from health for speech and language, occupational therapy, doctors, and from social services as well. And over the last few years in the UK, the numbers of children being diagnosed have increased a lot. Unfortunately, that's come at the same time as austerity measures and big cuts in public spending to education, health and social services, who are the very services that these families rely on. So you've got an increasing number of families and decreased resources going into the public service they need. And I think everybody who works in public services are really trying their best to support families, but they're stretched, and I think I can see the impact of that on families who access all of those services, and people are trying very hard to maintain and improve services, but it's at a difficult time nationally. There are two areas that I think are important at the minute. I think year on year where we're making huge progress is understanding the genetics of autism. And my practice has changed really in the last 3 years, and now that because our genetic testing has improved so much, when we're testing children, we're picking up genetic abnormalities, like I said, in about 10% at least of the children that we see. And that's because our tests have got better. It's not because the children have changed, and they're improving year on year, and I wouldn't be surprised if that goes up. Whereas I tested similar children maybe 10 years ago, we wouldn't find those difficulties because the testing that was available wasn't sophisticated enough to pick them up. So I think our understanding of the genetics is improving all the time and will continue to improve, so that's an important area of research. I think what's very important for families though is the increasing body of evidence for the benefit of early intervention, because the more research evidence that we can prove with trials that early speech and language therapy, support from psychologists, other intervention changes the outcome for that child, their family, and therefore for wider society long term, the easier it is to help us get services for them early on. If we don't have any evidence base to prove that extra speech and language or psychology works, then it isn't going to get funded, quite rightly, if there's no evidence that it helps. But the stronger that evidence is, it helps us as professionals to improve the therapy services we offer families. And equally, we don't want to be offering therapy to families that's a lot of work and stress for them if actually it doesn't make any difference to them or their child. So I think for me that's a very important area.